everybody's experience with endometriosis is quite different. To get an endometriosis diagnosis, it's really only diagnosed by surgery. You could have stage 1 endometriosis, but that could be causing you significant pain, especially depending on where it's growing. I would encourage you to definitely keep a list, like document and journal your symptoms. Today, I thought I would just do a quick video kind of talking about like what is endometriosis, and maybe you bumped into this video by nature of knowing somebody with endometriosis, that you've heard the term endometriosis and you just want to know a bit more about it. Maybe you have a friend or a coworker, or maybe you're a parent of somebody who has endometriosis or may have endometriosis and you just want to know a bit about it. So I thought I would actually just share from BC Women's Hospital. There is a clinic there called the Center for Pelvic Pain and Endometriosis. It's actually a clinic that I have been to as a patient myself, being someone who has endometriosis, who's been diagnosed with endometriosis. If you're curious about my endo story, you can go check it out in my other videos. But I thought I would just sort of share, actually from this clinic has just a great simple description of endometriosis, which says, a woman is diagnosed with endometriosis when endometrial tissue, which is the uterine lining that is built up and then shed with each menstrual cycle, has begun to grow in other areas other than the uterus. So when I describe endometriosis to somebody who really just wants to know what it is, I pretty much just say that. I basically say, so the tissue that makes up the inside lining of a woman's uterus basically grows in other areas of the body. So it's just the same tissue growing in other areas in your body, and typically causes a lot of pain. And for most women, they sort of experience that significant pain usually when they're actually having their period, but it doesn't mean that the pain is only limited to that time of the month. So you can experience pain like anytime from like some people. And this is another thing to sort of note with this is that everybody's experience with endometriosis is quite different. So my experience with endo and how I experience pain can be very different than somebody else's experience. And so, yeah, so like basically this lining kind of grows in other areas of the body, and typically kind of grows in areas like surrounding the uterus sort of area. So like in the pelvic cavity, on like around the uterus, inside fallopian tubes, close to the bladder, on the bowel, on like there's like uterine sort of ligaments that are in there as well. So it can kind of really grow anywhere around that area, but it really can also grow in other areas of the body too, which I think is less common. I'm not a doctor, but I think it's less common for it to grow in like other areas, such as like, just other organs like above the pelvic sort of area. But typically that's where it grows most of the time. And so symptoms of endometriosis, like I said, mostly pain, cramping. I have a whole video talking about like my experience with like how I experience endometriosis, what it feels like for me, what my pain feels like. So feel free to check that video out. But endometriosis can cause a number of other symptoms like constipation and diarrhea, nausea, fatigue. It can cause like bloating. There's lots of different symptoms of endometriosis, but pain kind of being a really big one. Even pain with sex, pain with bowel movements, other symptoms again. And you might be someone with endometriosis who experiences just like one of those symptoms, or you might experience all of them. So again, everybody's experience with endo is different. So how are you diagnosed with endometriosis? And to get an endometriosis diagnosis, it's really only diagnosed by surgery. So there's like a lot of myths surrounding like, you're just by talking to your doctor about your symptoms, they can give you a diagnosis, or even ultrasounds that can diagnose your endometriosis, both of which are not true. So they need to actually perform a surgery on you, either laparoscopically or I don't know, another way that they do surgery, but they need to actually go in and sort of see what's going on and like assess the tissue to be able to actually give you the diagnosis of endometriosis. And kind of with a diagnosis, you may have heard that there are different stages of endometriosis, which basically just kind of describe the severity of the disease in the body. So basically kind of ranging from stage 1 being more mild to stage 4 being severe. And I personally have been diagnosed with stage 4 endometriosis. And what I will say is that the stage that you have with endometriosis doesn't determine how bad your symptoms are. You could have stage 1 endometriosis, which just basically means there's a little bit of it, might not be a lot of it, but there could be like one lesion or like one growth sort of in there, but that could be causing you significant pain, especially depending on where it's growing. Whereas, with stage 4, you may have like tons of it, but maybe your overall pain is actually not super severe. So it doesn't mean like what stage you have, doesn't mean that your endo experience is like better or worse than another person's. And so you may be curious if maybe some of these symptoms sound familiar to you, if maybe you have endometriosis. I would encourage you to definitely keep a list, like document and journal your symptoms. Because sadly, I'm not sure this statistic has changed, but sadly, in the past, there has been a statistic around it typically being about 7 years of experiencing symptoms before a doctor will actually refer you, not to a specialist, but for you to actually have surgery to diagnose your endometriosis, which is interesting because in my case, it was literally that exact amount of time. 7 years had passed of me experiencing every single period, like pain, so much pain, debilitating pain, before I finally had a gynecologist say, we need to do surgery on you. Like, we need to see what's going on in there. So, hopefully that's not the case for you if you're having a lot of symptoms that sound like, pain that is like severe, or just enough pain that you're like, man, every time I have my period, like I'm in pain, or most of my periods I experience pain and it sometimes can like knock my day out, or it causes me to not be able to function how I normally function. Like, keep an eye on that, and I think that just sort of advocating for yourself and seeing your doctor and checking in and saying like, look, like I am experiencing, these are the symptoms that I'm having, and is it time for me to see a gynecologist, right? Or is it time for me to see a specialist who might be able to assess and explore whether or not I have endometriosis. So I'm kind of just like glazing over this, but I hope that kind of helps just answer the question around what is endometriosis. You may also have a question around, is there a cure for endometriosis? And sadly, there is no cure for endometriosis. There are ways to manage pain, to manage symptoms, but there is no cure for endometriosis. So knowing what your treatment options are, there's different kinds of treatments, different ways of managing pain, but there's no way to like eradicate the disease out of your body. So this is obviously upsetting information. The hope is that one day maybe there will be a cure for endometriosis. In terms of like what causes endometriosis, again, I'll kind of refer back to this really great site that I like to use because it really kind of just like simplifies things. And so what causes endometriosis? The exact causes are still not yet fully known. Some theories include changes in the immune system, environmental exposures, and genetic predisposition. So you may have, and actually it is the case for me that I actually do have an aunt on my mom's side who does have endometriosis. So sometimes they wonder if there could be a genetic link to if somebody else in your family has endo, you may be more likely to have it. So I hope this little sort of overview of endo is helpful for you, and please like and subscribe to my YouTube channel so I can keep sharing more videos about endometriosis with you. Thanks so much. Bye.